Health officials in West Texas have confirmed an unvaccinated child has unfortunately died from the measles.
This is the first death linked to an outbreak that started last month and the first from measles in the U.S. since 2015. This afternoon, a hospital in Lubbock where 20 patients have been hospitalized offered an update.
Measles is a respiratory virus that causes a viral pneumonia that may necessitate some extra support for those patients while they're trying to recover. And so we've had patients who've required treatment with supplemental oxygen and sometimes higher levels of oxygen in order to help them with their breathing while they're recovering.
Well, the measles, mumps, and rubella vaccine is required for children before they enter kindergarten in the public schools nationwide. But Texas allows some exemptions for religious and other reasons.
So diving deeper into this, joining us now to discuss the health crisis is Dr. Susan Wootton. She's an infectious disease expert with UT Health. Thank you so much for being here.
Thank you for having me.
Now, our biggest question is how much worse could this outbreak potentially get before it starts to get better?
Yeah, it's going to take a bit, I think, for this particular outbreak to turn around. Sort of expected times, I'd say, are between 2 to 6 months based on prior outbreaks.
And so when it comes to children, I know that we reported on this was an unvaccinated child. So for parents who haven't had their child vaccinated, obviously the message is to get it done, but you need to get it done soon.
Yeah, so we give our measles, mumps, and rubella vaccine, otherwise known as the MMR vaccine, at age 12 to 15 months and age 4 to 6 months. So there are 2 doses for children to have received their complete vaccines. It takes about 2 weeks for the vaccines to create immunity. And so for those parents with kids who are age 12 to 15, now is the time to figure out if they've had their MMR vaccine and go get it done. If they're age 4 to 6, now is the time to go and make sure that they've gotten their second dose of vaccine.
Can adults who may not be vaccinated, can they get the vaccine?
Yes, they would get the vaccine. If they've not been vaccinated, they should also get vaccinated.
Now, there is this anti-vax movement that has started. How concerned are you about that?
Yeah, so I think it's a good time for people who are on the fence about vaccines to have a serious conversation about it at home with their family members. And so measles is one of our most infectious pathogens. The attack rate is about 90%. So, for example, if a person with measles walks into a room of 10 unvaccinated people, 9 will get infected. It has some of the most serious consequences for people who get infected. So, for example, 1 in 5 of unvaccinated people will be hospitalized if they get measles. 1 out of every 20 children would get pneumonia. 1 out of every about 1,000 who get measles will end up with a brain infection that can lead to things like seizures, deafness, or intellectual disability. And nearly 1 out of 1,000 will die. And so the fact that we've already had 1 death as part of this outbreak implies we've had potentially at least 1,000 total cases. So remember, we've had 124 reported, but that's only the cases who A, presented for care, B, where they had a provider who recognized measles, and then 3, sent the appropriate testing to pick it up.
Now, we do like to celebrate in big gatherings, birthday parties, big events.
Yes.
Is that something that people should be concerned about at this point with this going around?
Yeah, I think at this time they would do just, regular guidance for when you're not feeling well, you should stay at home. And I think at this point, our public health teams are keeping very close track of what's happening and has, updated information and resources for families at a county level on the State Health Department website. And so for now, we have 9 counties where they're picking up cases in the western part of Texas. And then we're also tracking pretty closely what's happening in the San Antonio area because there was an exposure there. A person with measles visited the San Antonio area on February 14th. And the other aspect of this virus that's tricky is what's called the incubation period is long. It can take about 2 up to 3 weeks before someone who's been exposed becomes symptomatic. Oh, wow. So that region for San Antonio is still under a period of being observed. So we're only about 2 weeks after that exposure.
All right.
So, yeah.
Well, Dr. Wootton, thank you so much for this information with UT Health.
Yeah, very helpful. Thank you so much.
Okay, thank you.